Welcome to Pretty Noir Health. Today we're going to be having a discussion about urinary tract infections. This is an infection that involves any part of the urinary system from the urethra to the kidneys. And there's so many causes of UTIs that we're going to discuss in a minute. I just wanted us to know that women are more prone to urinary tract infections than men based on our anatomies. Our urethras are really close to our rectums, like the rectal opening. So it's very easy for bacteria to travel from the anus to the urethra, causing a UTI. We'll see common signs and symptoms with UTIs to involve urinary frequency, urinary urgency, pain with urination, having to urinate a little bit at a time. People also often report abdominal pain, back pain, flank pain. We can also see changes to the color of the urine, tea-colored urine, Coca-Cola colored urine, pink tinged urine, red urine, foul-smelling odor from our urine. These are all indicative of UTIs. And also with complicated UTIs that goes up to the kidneys, people start having things like fever, chills, nausea, vomiting, pain, really bad flank pain. That's when when it's like in the kidneys, it's called pyelonephritis, and that is a complication for untreated UTIs. So what do we do to prevent UTIs? Some risk factors for urinary tract infections, like I mentioned earlier, the female anatomy, sexual activity, anatomical defects with the way the urethra sits, certain birth control methods for women that use like spermicides or the diaphragm method, hand hygiene, poor hand hygiene. When you clean down there, you could get yourself a UTI by just putting bacteria where it's not supposed to be. And also menopause is said to cause UTIs in some women. How do we prevent urinary tract infections? Adequate hydration, drink lots of water, avoid using feminine products, do not douche. Also, cranberry juice has shown some benefits in women. Try to avoid after sexual intercourse, and most importantly for women, clean from front to back. If you do suspect that you have a urinary tract infection, check in with your primary care provider, just a quick urine dipstick, so you can get on the appropriate antibiotics. Again, we're trying to keep the complications like pyelonephritis, worst case scenario, sepsis, and especially in the men with frequent UTIs, recurrent UTIs, poorly treated UTIs would lead to narrowing of the urethra, which potentially puts them at more risk for urinary tract infections and other complications. Again, this is just a health tip with me. If you have any questions, please feel free to ask. Again, thanks for watching.